Welcome to The Explainer. Ever stop and think about what's running your body on autopilot? Well, today we're going to dive into that hidden system and find out how modern medicine actually learned to grab the steering wheel. So let's just start with a simple question. Think about it. Right now, as you're listening to this, your heart is beating, you're breathing in and out, your pupils are adjusting to the light, and you're not consciously doing any of it. So who's in control here? Well, the answer is this incredible, powerful, and pretty much invisible network called the autonomic nervous system, or the ANS for short. You can think of it as the silent operator that's managing all your body's vital functions 24/7 without you ever having to give it a single thought. Okay, so the easiest way to get your head around the ANS is to think of it like the controls in a car. It's got two main parts that are basically opposites. You have the sympathetic system. That's your gas pedal. It revs you up and gets you ready for action. And then you have the parasympathetic system. That's the brake. It cools you down and helps you, rest and digest. All right, let's open up our first case file, the human eye. It turns out the eye is the perfect little window to see this whole gas pedal and brake system in action. And it's going to help us introduce the fundamental rule for how drugs can take control. So the problem we're investigating here is a condition called glaucoma. This is where the fluid pressure inside your eye builds up to dangerous levels. And if you don't treat it, it can seriously damage the optic nerve and even cause blindness. So yeah, this is serious stuff. Now, this is where it gets really interesting. How do doctors actually treat glaucoma? Well, they use a whole range of drugs that essentially hijack the eye's autopilot. This chart here shows how some drugs work by decreasing the amount of fluid being made, while others help it drain out faster. They are directly manipulating the ANS to get that pressure back down. And this classic rabbit eye experiment illustrates the whole concept just brilliantly. Take a look at this table. Adrenaline, which mimics the gas pedal, makes the pupil get wider. It dilates. Pilocarpine, on the other hand, mimics the brake, so it makes the pupil constrict. But then look at atropine. It blocks the brake, which, if you think about it, has the same effect as hitting the gas. The pupil dilates. It's all about pushing one lever or blocking the other one. All right, now for our next case. I want you to imagine you're a scientist. You've got a little vial, and inside is a total mystery drug. Your job is to figure out how it works, and your only clue is seeing how it affects this tiny little strip of tissue from a rabbit's intestine called the ileum. So, first hypothesis on the table. Is our drug mimicking the parasympathetic system? The brake system. Well, if it is, then a drug that we know blocks that system, something like atropine, should completely cancel out its effect, right? So let's add it in and see what happens. And would you look at this graph? That first wave shows our mystery drug causing a really strong contraction. But then, after atropine is added, that second wave is totally flat. The drug's effect just vanishes. Boom! We've solved it. Our mystery drug works by hitting the rest and digest, the brake pathway. Okay, let's reset. Let's try a different unknown drug. This one seems to cause the tissue to relax. So our new hypothesis is, could this drug be mimicking the fight or flight system? The gas pedal? To find out, we're going to use a beta blocker, a drug that's specifically made to block that exact system. And the evidence here is just as crystal clear. The graph shows the drug causing that relaxation. But once you add the beta blocker, poof, the effect is completely gone. By selectively blocking a single pathway, we figured out exactly how our mystery drug works. It's a gas pedal mimic. Case closed. Okay, now for our most complex case yet, and this one's a real head-scratcher. Adrenaline's effect on blood pressure. Now, adrenaline is the ultimate fight-or-flight chemical, so you'd think it just cranks up blood pressure, end of story, right? Well, it's not quite that simple. When a high dose of adrenaline is given to a test subject, we see this really unusual result on the graph called a biphasic response. So the blood pressure spikes up dramatically at first. That's what you'd expect. But then it drops, and it stays lower for a while. This is a genuine puzzle. Why would the body's ultimate gas pedal chemical suddenly look like it's hitting the brakes? Why would it cause a drop in blood pressure? It seems to fly in the face of everything we've just figured out. The key to cracking this mystery lies in a famous pharmacological principle, the vasomotor reversal of Dale. The theory goes that adrenaline actually hits two different kinds of gas pedal receptors at the same time, one type that raises pressure and another that lowers it. So what if we could block just one of them? And that's exactly what scientists did. This graph shows what happens after they add a drug that blocks the alpha receptors. Those are the ones that cause that initial pressure spike. Now, when they add adrenaline, the spike is gone. It's just gone. All that's left is the drop. They literally reversed adrenaline's main effect, and in doing so, they revealed its hidden secondary action. Mystery solved. So after we've looked at all these different cases, the eye, the gut, the heart, it seems really complicated. But what's so amazing is that it all boils down to one simple, incredibly elegant rule that explains how all these drugs work. The big takeaway is this. Pretty much every drug that messes with the body's autopilot does one of only two things. It either mimics a natural signal to turn a system on, or it blocks a natural signal to turn a system off. That's it. It's that simple. Mimic or block. Press the gas or block the brake. Really, the best way to think about it is like a sophisticated lock and key system. Your body's receptors are all the different locks, and its natural chemicals are the keys. Modern pharmacology is just the science of creating these incredible master keys that can mimic the originals or designing plugs that jam the keyhole completely. And this leaves us with a really fascinating final thought. Learning how to precisely control our body's unconscious functions, its autopilot, was one of the biggest leaps forward in the history of medicine. It lets us manage everything from blood pressure to glaucoma. So the question is, what's the next autopilot system for medicine to master? The immune system? The microbiome? The future is wide open.